crashed the party, right?
I'm so sorry. I'm supposed to be helping Dr. Jess, but she will be expecting, can do this for a few minutes and I'll
Yes.
go help her out. Yeah, my name is Wan Shin. I've just accidentally walked into this party.
Yes.
And I accidentally landed on this job too.
Yeah, so you graduated from
So
Manchester.
I actually graduated from University of Manchester in
So UK graduate.
Yeah, UK graduate, so in 2016, and I moved to Australia and I was looking for a job, and I saw this ad and I applied for it, and I came in, although it's in Launceston, I have no idea where Launceston is, but when I applied,
Same.
when I applied, Dr. Bing was like, come and have a look for yourself and see whether you like this place or not, because at the end of the day it's a bit regional, and the regional lifestyle may not be for everybody. So I flew in and I had a look at the town and stuff, and surprisingly I find quite comfortable and I do enjoy it. And at that time Innova was not built yet. When I just joined, we were still at Prospect and also Canning Street Dental. Even then, even though like we were not as like polished as we are now,
not such big premises.
yeah, not as such a big premise, or like not as renovated as we are, because we just took over Dr. Oscar's practice, which was quite traditional, but we did but you did put in a lot of like new technologies in there as well. Yeah, because being at the NHS, everything was made for fit for purpose only, so you don't really challenge yourself to do more. And for the first time I visited, I saw Dr. Fei doing a CEREC crown, and I was like, wow, this is so interesting. And I was thinking that like, wow, if I join this practice and this is what I get to do, and I get to learn and get to see, and I get to experience. So that was the first thing that caught my attention.
If there was anything that you want to tell somebody who's looking to apply, what would you say?
I think like, don't limit yourself. If don't feel like my clinical skills is not there, I don't know what I can offer to the practice, so then you become very worried about applying. But if you have like an open mind and you are willing to learn, willing to challenge yourself, then I think then you are more than enough to apply for the job. Because I felt like when I look back, when I was applying for the job, I was just merely looking for a job, really. I don't know what I walked into, and I actually don't know what Dr. Bing saw in me. But I've time and time told him again, thanks for hiring me, because it is a journey that I've never regretted. And from just somebody that just do things to fit to function, and being challenged out of my box to think a bit more of why I do things. And I feel like I've come a long way, and I would say that I've come a long way. I told him the first thing that I could offer was to the practice is because I pride myself as being a team player, and I think I have a very outgoing and bubbly like personality, which I can gel well with patients. But that was the only thing that I could offer.
I think really, that is the most important thing, right? Good attitude, playing as a team player, and having a personality that is not antagonizing, right? And doesn't piss people off.
Yeah.
I think that's very important, right? And so, that's all you need. Everything else we can teach, right? Everything else we can build on.
It's true. And then at the start, I was a bit apprehensive about learning as well, because it's a new environment and things like that. And it's hard, but then if you keep your mind open, and I'm sure you'll get something out of it, and then in return you will have more to offer as well. So I think
as you grow,
you will have more to offer as well, and you will be proud to know that you are actually becoming, you're growing in the team, and that you are not just on the receiving end, and then you are also offering as well. So I think the most important thing is that as long as you are open-minded, open to learn new things, and open to challenges, I think that's my best advice. I say you can pick up a pen, or nobody use pen anymore, but you can start applying for the job. I think I think that's the most important thing.
For yourself.
Yeah, to add on to Wan Shin's note as well. Don't be afraid to step outside your comfort zone. If you feel like you're at a space where you've worked for a few years and you feel like, oh, is this all that's it? If you feel like stagnated.
You have a quarter-life crisis.
Quarter-life crisis.
Quarter-life crisis. Oh my gosh. Yeah, but don't put barriers on yourself. You can achieve what you want to achieve by putting the work in. Yeah, so yeah, don't be afraid to join an excellent practice, because if you surround yourself with excellent people, you are going to be excellent.
I think it's the whole sort of like flying with eagles. You know what they say, right? A metaphor, right? Where if you hang around with turkeys, you become a turkey as well. And what we always try to build, right, is this place where we've got multiple clinicians that are good, super solid, friendly, good to be around with, nice people, and happy to help, right? And I'm thankful that we've managed to build something like that. It's great to have you guys around, I'm thankful to have associates like you guys, right?
So another thing that I would say as well is that, like, in adding on to be open-minded, having an open mind is also being open to accept constructive criticism. I think we do that a lot to each other, not to put each other down.
Yes.
Not to put each other down, but to help us get better.
Yeah.
Like, to
Even
get
for myself
better.
as well.
Even like sometimes we have a laugh at Dr. Bing as well when he's struggling. Because like if you want to grow, there's always going to be struggle, and don't be embarrassed to show your work and things like that, because it is only through constant discussion and looking at your work closely that you will be able to achieve the growth that you want to achieve. So I think that, like, mainly, I think the most important thing is be open-minded and be willing to grow. I think then, and everything else just comes as a package, I think.
And I think growing is a weird thing, like you need to struggle to grow.
Yes.
And then, once you stop struggling, you stop growing, and then you start to stagnate, right? And so it's always about how do we, as a mentor, as a boss, it's always about how do we manage that growth process, that we are pushing everyone enough that they're feeling challenged, but not pushing them so much, and not also letting them just stay at the same spot, because we can all do better, right? And I think feedback is such a big part of it, and even for myself, right? I think when something like the implant falling out sort of happens, we try to take it as it is, understand that complications happen, deal with it, fix it, then we try to move on. Yeah.
We're really trying to be very vulnerable here. Like we are, I know we,
therapy session.
We post a lot of like good work on Instagram and stuff like that. We celebrate all the wins, but I mean, at the end of the day, dentistry is dentistry. We all have our struggle, but then I think what we have here is a very good support system where we can pick each other up and we can help each other out. We don't have to just process it by ourselves. Yeah, we have a very close, I feel like all the dentists here, we are very tight-knit with each other as well. We celebrate our wins. We also we also sit with each other when we don't feel as good about our work as well. When we feel defeated, we pick each other up. So I think,
and that happens now
and
and
that
again.
happens, and it can happen to anybody. Dr. Bing can have a bad day and coming into our room to share his bad day, and we will say things to help him get better as well.
Yes.
So yeah, I think we do have a very close-knit team, and if you feel like you want more support, and I think when I first joined the practice as well, Dr. Bing asked me, what am I looking for? I wasn't sure about what I want to achieve clinically back then yet, but the only thing that I told him is that I want support, and that is all I asked for at my new place, at my new workplace. And he's like, we got it here, and they do deliver. So if you want support, so if you want support, yes, we are all, I think the team is ready to support, and so you are more than welcome to come and experience this for yourself.
Yeah, I second that. Yeah, I don't think there's any other practice that has this amount of support. Yeah, from the bosses, from the colleagues. Yeah, especially such a big practice as well. Yeah,
and I guess support, not just saying that we'll just do everything for you, right? It's also pushing you, letting you make mistakes in a safe way, letting you struggle a little bit, and then when we see that you're giving up, we pick you up and then we, carry on. Always happens with the first direct case, right?
Yes, it does.
But the design phase, you're like, I'm done. So, and then we help you, and then after that, as you get more and more comfortable with the process, we step back more and more, which is good.
On top of what we mentioned, don't feel like you're too old to apply. I guess it's not in the sense that I'm
clinically experienced.
I'm Are they looking for someone, who's just fresh out of uni? That was my barrier before applying, because I thought like, oh, maybe they're looking for someone younger that they want to train. But yeah, don't put that barrier on yourself, because it's never too late to learn. It's never too late to continue to grow. Yeah, so yeah.
I think it goes from on both hands, right? Like on one hand, like someone experienced, if they're willing to learn, it's great, right? And I think I think the worst thing that could happen is that if you want to join a practice like ours and then you don't want to learn, right? And then it's like a struggle to like go through stuff, and then we never get anywhere. I think we haven't had that. We are always very careful with how we pick dentists to join our team, but certainly I think there is this perception, right, that our job ads the dentists we get are all new grads, right? And then that's not the case. I think even when David came recently to run our course, he saw our team and he was like, shit, you guys have pretty much everyone, like Olan is our only new grad, right? Everyone else has got some experience. Most of our dentists actually joined us, with 2, 3, 4 years experience, and then they hung around for 3, 4, 5 years, right, depending on how long they've been with us. And I was like, yeah, that usually is the case, because we do get applicants who are experienced, and we do get applicants who have had some experience and are looking for a change, and we are certainly able to sort of accommodate that. And I think this popular perception, I think, is how we write our ads sometimes, but it hasn't stopped you. I think both of you experienced when you joined us, and so I feel like don't let that stop you if that's what you're looking to do, because there are people like these guys who have joined with some experience and they've continued growing, right? Hasn't stopped. Yeah. So anything else that you want to add in? They have sort of the last burning points. Yes. Anything else that you think that you want to add? Whoever's sort of applying and whoever's looking to apply. I mean, we don't have a job ad out yet, but when we do, yes, what would you like to, anything else that you want them to say?
No, I think
Want to say to them, sorry.
come and see for yourself. Come and see for yourself. Yeah, and also
it's very hard to.
Yeah, it's very
it's
hard.
Really hard to
experience.
Yes, to convey it through. Even with our posts, even with our videos about when David comes, when Tom came, and
if you are like, because like how to say like, although like we tend to, this is not. I mean like. You can see all the ads and everything, but it's really, really hard to really tell you what it is like. But if you have come here...
just spent 3 SD cards worth.
And it's still very hard. Like, so come and see for yourself, because for myself, like, back then, even if we were in Prospect and Canning Street, I came and see for myself, and I felt this is what I wanted. And that is why I how to say that, I've already applied, but I felt I wanted, so I further express my interest. Even for Olan as well, she was excited about coming, but ever since she came and visit for a few days, she was even more certain. And so she also went up to you and expressed that this is what she wants, and hopefully she will be given the opportunity. So if you come and see for yourself, there's no harm. So I say that, like, if you find that we are the team that you would like to work with, then I think it will be good. Because I also remember, like, when I came to have a look at the practice, I was also looking at another practice at the same time.
Yes.
And so I was looking at the two practice, and it was very clear to me that this is the environment that I wanted to grow. And that is why before I left, I told Dr. Bing that, like, I would love to be given an opportunity to grow with the team, even though I know clinically maybe I'm not ready. But I feel like this is a place where I feel like I'll be learning more. Not that the other place is not good. I could possibly fit in comfortably as well, but then, like, there is no, how to say, even though I keep telling him that I'm very apprehensive to growth, but I feel there is that small desire in there that wants to grow. So if
I think everybody does. Yes.
So if you have that desire to grow, then I would say come and see for yourself, and then that's the best advice that we could give. I think, like, we talk so much about being open and all those things like that, and then there's only so much that we can tell you. But, like, really come and see for yourself. Really, like, your trip is not going to be wasted because even if you don't like us, Launceston is very nice anyway. So
Yes.
you get a holiday.
You'll
So
be
you
very
get,
impressed with
you'll-
the setup
yeah.
here anyway.
So it
And
is
how
a
things
nice
are
place.
run.
Just take it as a holiday. Come and see, and we will be more than willing to show you what we have as well. I'm sure Dr. Bing will be more than willing to show what
Yes.
we have. Yes.
Thank you so much. Man, it was. You guys were tired.
All right.
Yes.
That's okay.
Yes. No, thank you so much.
No
Really
worries.
appreciate
You
it.
must be
Yes.
tired too.
Thanks. I need to still go and
Yeah.
do a small design. The other one waiting
Oh,
for me.
small design.
Yeah, you guys can come as well.